are live on the internet, and here come our faces. Hey! Greetings, guys, gals, and non-binary pals. Welcome to Viral Transmissions, episode number 13. Thank goodness that's over, right? We're all done. Time to burn your masks, much like bras back in the previous century, and go back to normal old living, right, Rob?
I love our freedom.
And before we go anywhere from there, I do want to mention that we are still supported by the BC Humanist Association, who are great people, and you can check them out at bchumanist.ca. Big thanks for their support. It's huge. I love it. Well, it's not huge, but it's huge to me that we're being supported. So Rob, we're all done, right? No more masks needed.
Well, that's essentially it. You'll notice that we didn't start on the balcony tonight.
Yeah.
The healthcare cheer has stopped. I actually look out this window that you can't see onto the balcony, and there's nobody out there clapping. You don't hear the bells jingling. You don't.
Mm-hmm. Well, Sunday is the day of the Sabbath. It's a day of resting.
It's the day of resting. Yeah.
Yeah.
So
even my neighbor kids who like. I'm sure their parents are pretty controlling. I don't know many details, but just that's my assumption from the way that family seems to be run. They have thrown themselves into it because they get to bang pots and pans, and their parents support it. But even they have stopped the past week or so. So they're not even like reveling in their ability, their allowance to make noise. It's kind of wild.
Yeah. So,
especially since like the numbers, the numbers in BC are down. We've had, has it been one total this? Like I know we had several days of no deaths, and I think we had I saw a news article saying our first in a week, and our new numbers are pretty low, which is good. We're starting to really get this down.
Right.
We're no New Zealand, but
we're no New Zealand.
BC's in good shape. Newfoundland's in great shape. Newfoundland hasn't had a new case in days.
Oh, good.
The maritime provinces are good. Ontario and Quebec are, well, they're still grumbling along. But there's some evidence that maybe they're starting to turn it around. But what's fascinating is, if you think back to March when we all realized, either collectively or legally or a bit of both, hey, we've got to stay home. We've got to stop gathering in big crowds. We've got to crush the curve, as it was called, right? There was that big illustration with this curve, healthcare capacity.
We don't like that curve.
And then
we like that curve.
Flatten it, right?
Mm-hmm.
So we all said, okay, and we all signed on. And then, we stayed home. But there was some kind of a problem, at least in some places, with the second part of that message maybe didn't necessarily get spread as clearly or as loudly as it could. And the second part of that message is, by the way, we lift public health measures once certain things are in place. Now, okay, here's a pop quiz for you guys.
Okay.
You guys know what the things are that let you lift the restrictions?
Is it there's bed spaces in hospitals now?
In BC, there always were. And we're lifting our restrictions. Yeah. Because we never had that big first crushing wave. We managed to stop it pretty early.
So it wouldn't be the availability of masks?
Nope. Back in March, masks were still not considered an important public health measure.
So we're talking about what it takes for restrictions to be lifted.
What do you need to have in place according to like the World Health Organization, the CDC?
Wow, yeah, that's a good question. I think
maybe somebody in the chat knows.
I don't know the right way to phrase this, but like a handle on the numbers, knowing how. Like it's not. I suspect it's not just low numbers. You also need to kind of know the general area of where they are, so that you can focus your control of that. Is that it?
Someone in the chat has popped up.
Right.
Okay, yes, one is good contact tracing.
So yeah,
We need to get good contact tracing in place, and contact tracing itself depends upon the availability of
Pens and paper.
pens and paper.
professional
Certainly you can't-
contact tracers.
People who know what they're
Testing.
doing.
Testing. Okay.
Testing. So the whole point of clamping down on everything was
Okay.
because we had sustained community transmission, but we weren't quite sure where it was. So since we're not sure where the forest fire is exactly, because there's too much smoke, we've got to just kind of blanket the whole forest, get the fire out, and then what we do is we spot little fires, jump on them right away. And the way you
Right.
spot the fires is with testing, and then contact tracing, and then isolation. So
Okay.
test, trace, isolate. That's the thing that lets you come out. And it's
So it's basically less ignorance.
right, yeah,
Mhm.
because we went from a time in March where, okay, we're not exactly we don't have a good state of knowledge of where all the cases are. And Eskimil's kind of already dropping the spoilers uh, for what's happening.
Yeah.
But the whole point of that part one was not only to crush the curve to keep it below healthcare capacity, but also to get in place a scheme of testing, tracing, isolating at scale.
Mhm.
And in BC, we've done that, right? But
Congratulations.
what hasn't happened as well, and we did it like ages ago, right? But what didn't happen was that communication of this is what we need to do that lets us kind of reopen the economy, let everyone go back to school. And there's been enormous confusion. I think there's even been some confusion in BC, even a place where there's been excellent communication around pandemic infection-related issues. So in a lot of places in the U.S. where there never was any federal government support for massive test, trace, isolate, people are still just kind of languishing at home. And they're not getting financial support. There is no stimulus coming from the government. So people are really stuck in this desperate spot. So the economies in a lot of places, folks have either just gotten bored or they've just opened up, and we're starting to see in the US where it had been kind of because there was no testing, tracing, and isolating, there was about 20,000 new cases a day and between 1 and 2,000 deaths a day for about 70 days. It was the only country that had that just flat. That first wave never broke. It just kept going and going and going and going. And at a certain point, a lot of governors under the bizarro rules of this thing doesn't exist, and if it does exist, it's just a flu, and make America great again, and I have to get reelected, and so we can't have bad test numbers. Just a massive clusterfuck of no testing, no trace, no ice. At a federal level, certainly. Some states have managed to get their act together. Canadian provinces have done a pretty great job. So at some point, it's almost like collective amnesia took hold, and everyone just started going back out. Everyone just started going back to work. And
Yeah, I was at Canadian Tire today, and my girlfriend and I, and one of the customer service people, within eyesight of me, and there must have been 30 people or more. We were the only one who had masks on. Everyone seemed just going about their usual business,
Yeah.
like it was 2019.
Yeah. I've really been noticing, two populations, and one of them seems to be dwindling. There's the population of people who care, and in certain places it's higher, like my local grocery store. The people most of the people getting groceries were masked and practicing social distance properly, and so that you'd get the exceptions. But it's attached to a mall, and then when I wasn't in the grocery store, but like looking through the mall, way more of the people in the mall were unmasked and also like just walking past each other with no thought about social distancing or any of that kind of thing.
Right.
And yeah, it really feels like it's falling off now. And I hope I hope that we've got enough of that contact tracing that the people who are potentially going to be spreaders aren't even in that mall right now, right? And then it doesn't matter. If nobody who could spread it goes to the mall, then it doesn't matter what these people do. But all it takes is one person to go to that mall and walk around a bunch past all these people, and all of a sudden, poof, outbreak, right? And so really what we're doing is we're dealing with these low possibility things, right? Like, granted, if you don't wear your mask, you're probably okay, but you run the risk of becoming part of a giant bad thing. It's kind of you have to recognize that low percentage of badness is overshadowed by how bad the badness is.
Mm-hmm. Right,
right. Like it's in poker terms, right? We're kind of pot committed to wearing our masks, like, or not pot committed, but like the money is there, or the cost is there for that low percentage outcome.
Right.
Yeah.
Yeah. So what could you say? There's sort of a few things going on, right? So back in February, March, there wasn't clear science. All the best science looking at previous pandemics had said it looks like mask wearing by the public didn't make a difference. So we're not going to make a recommendation about that.
Right.
Because before you make a recommendation, you got to think about, all right, what are the downsides of making a recommendation? Is there a risk from masks? Is there a risk of supply runs from masks? If we're making this recommendation, the evidence suggests it doesn't make a difference, and are we just going to end up eliminating supplies from frontline workers?
Yeah.
And in fact, there were runs on masks, just like there were runs on toilet paper and Lysol wipes. All that stuff was just gone, and in some places has only recently started making its way back onto the shelves.
I remember those 2 weeks.
You remember, yeah, and for some people it lasted a lot longer than 2 weeks. So then the evidence starts to come in, and it begins to pile up, showing, well, you know what, masking appears to make a difference. So we knew early on, yes, people with symptoms definitely need to be wearing masks. People caring for people who have symptoms should be wearing a mask because that's a close contact situation and you need to reduce the difference. What was unclear is, does it make a difference for members of the public who don't have symptoms, who are just kind of breezing by one another and ideally maintaining proper social distancing? Well, that evidence is now coming in, and it seems to be the case that, yeah, it does make a pretty significant difference. So you look, for example, at a place like Japan, where there's really broad mask use is happening, but also where they were very, very diligent about getting on top of outbreaks, super spreading events, really vigorous contact tracing, isolating, testing. So they were doing all of that all at the same time. And you can kind of now get to the point where we can make a universal recommendation for masks for everyone. But what happened in the meantime is this somehow got tangled up in a lot of places as an issue of personal liberty. I've got a friend who is a professional poker player down in Vegas who refuses to wear a mask on libertarian grounds and says,
it's my right to get sick and get other people sick as well.
Yeah. Sorry, but it's not. The whole right to swing your fist ends at my face argument, which most libertarians should be aware of, completely applies here. By not wearing a mask, you're swinging your fist at everybody else in that area. Like,
yeah, but it's a widespread attitude.
Yep.
There's a trending hashtag on Twitter now
Yeah.
called "Take Off the Mask," which I've just started to become aware of recently. It's actually a hashtag that started last fall of 2019, in the autism community, around don't feel the need to kind of wear a mask in terms of your personality, in terms of what you present, just be yourself. And that kind of in May is the first time it started getting picked up in certain right-wing political talk, and getting linked with Obamagate was the first use I saw of it. And there's this political cartoon of an Obama mask coming off, and there's somebody wearing an ISIS balaclava underneath.
Of course, yeah.
Take off the mask, yeah. And then when the Patriots all started showing up with their AR-15s at state capitals saying, "End the lockdown now." And the irony is, you probably, masks, it turns out, are probably so effective, you probably could end all the lockdowns if mask compliance was high, you really could just open everything up.
100%. Yeah.
We didn't know that in early March. We kind of much have a better idea of that now. And that might even be the path forward to us actually being able to prevent future shutdowns, is if we can get high enough mask compliance. We'll see if we get there. I got my worries based on things like Take Off the Mask, which kind of got mixed in with political messaging. But then in June, it started to getting mixed in with pseudoscience. There's a sort of a kind of a famous crank neurosurgeon, Russell Blaylock, who wrote a big research piece in June on how masks are bad for you, and if you're healthy, masks present health hazards. You're rebreathing your own toxins, and you could actually be accumulating pathogenic particles on the inside of the mask, and
Yeah.
it's just wild nonsense. And it's coming from a surgeon, a guy who wears a mask 4 hours at a time while doing surgery, or at some point must have, right?
Surely there is tons and tons of research into how much slightly more carbon dioxide you breathe in when you're wearing a mask. Like, isn't that the kind of research that some young up-and-coming student would think, I'm going to do that research and find out, see if it's a problem?
Well, you can do it on yourself, right? You can get
Yeah.
a pulse oximeter. You can get them, for go
There you
for a
go.
month of drugs for like $20-$30 and see what happens to your oxygen level with and without a mask.
Yeah.
I guarantee you, I give you the Dr. Rob guarantee, your oxygen level won't drop when you have that mask on.
Like, there's lots of carbon dioxide in the air already, right? Like, and
it's sort of like,
and there's only so much volume.
And it diffuses. It diffuses out. It's a gas, right? Like, if you're at the other side of the room and you fart, I'm still going to be able to smell it, even though it's double masked.
Yes.
Carbon dioxide's just like that. It just diffuses out. Gas is freely permeable across masks.
And
even
also,
N95 masks.
like, your mask is only so big, and it's up against your face, so the amount of storage of a gas that could be trapped in front of you is so small compared to how big your breath is. You're still breathing in air from here outside your mask. Like, the whole it's not like you're wearing a fish bowl around your head and eventually you will suffocate. It's a tiny little
isn't a plastic shopping bag.
Yes, thank you. We have determined that a mask is not a plastic shopping bag.
It's going to be fine.
They don't come with warnings not to put them on children.
Now, I have a question, because this is something that I thought of because I was getting angry about this stuff before, but I think now that we kind of understand masks, I think this is a reason to not be angry, and Eskimio mentioned it before. So masks, we're finding that they are necessary when you can't maintain social distance. So what that means to me is when you see these people who like walk down the street not without a mask on, non-crowded street, right, or driving their car, which we mentioned their mask was around their throat, like, as long as they're properly applying it, not and being careful of their hands and stuff like that, that's fine, right? As far as we know, to be like, oh, now I'm going near people, mask on, go into the crowded place, do all your stuff, leave,
Yeah.
mask off. Is that probably okay? Because I think that it is.
If you're doing hand hygiene, that's probably okay, right?
Okay.
So if you put that mask on, get the sanitizer before you go touching all the radishes.
Right. Yeah. Okay.
Yeah, that is probably okay. Um, or even without a mask, if you're briefly passing by somebody on the street, you need to get a certain infectious dose of virus before you get infected, right? And you're not going to get that infectious dose just walking by somebody,
Right.
unless you happen
But
to.
I'm walking like 20 by 20 people per minute.
Well,
In that.
if all 20 of them are infected, then maybe you got a problem,
I
right?
see. I see.
So, if only one of them's infected, it doesn't matter, right? In that sense. But the issue is if the 20 of you are in a room where there's no proper ventilation, well, that's going to start to get around. And there's some interesting research that came out Friday suggesting that one of the things that masks do is prevent aerosolization of the virus. And initially we thought, okay, this is a respiratory virus, meaning it's transmitted in respiratory droplets. It doesn't seem to be transmitted in aerosol droplets. Typical aerosolized diseases like measles, they hang around. You can walk in a room 2 hours later and get it. Well, it seems that coronavirus is maybe somewhat like that. It's not like the measles in that, one sick kid in a doctor's waiting room and 50 people go home sick who came to see the doctor that day. But there does seem to be an aspect of it that's aerosolized. So the respiratory droplets hit surfaces and lead to contact contamination. And masks don't stop you from inhaling aerosols, because masks don't stop you from inhaling cigarette smoke. But what masks seem to do is to prevent atomization and the formation of aerosols in the first place. And
Okay.
that seems to be the mechanism of how they work to prevent you from spreading it to others. So they catch the big droplets, but they also prevent the aerosolization from happening, which is important. So yet another reason to wear masks. And it seems that this has made the biggest difference where it's been applied, regardless of things like weather, humidity, temperature, sunshine, things like that. The masks have made the big difference, and I'll just grab this research, Proceedings of the National Academy of Science. Let me grab this and drop it in the chat, because it's a really interesting article, and it's free.
Free articles.
Free articles. There we go. There it is for all the folks at home.
I don't know.
And so we're just still learning just basic fundamental things about this virus, because every goddamn virus just does its own thing in its own way. They're not interchangeable little robots. You can kind of sort of model them like that when you don't have information, but as soon as you actually get data, you gotta substitute that in. But this is good news, right? Because this means if we can just get high mask compliance, the second wave, we can approach it in a completely different way than we approached the first wave back in March, because we just didn't know then what we know now, which really is kind of an amazing testament to how much science has been done in the last 10 weeks. I think there have been something like 174 papers published on the effects of masks in coronavirus just since this thing started in the last 12 weeks. So that's a pretty good rate, right? That's 10, 15 papers a week, maybe even, approaching 20. But this one seems to be kind of a really new critical addition to that literature.
Yeah, I'm again like I can remember arguing with friends online who were talking about masks all at the beginning of this thing. And I was like, look, the science that we've got right now says don't, and here's a bunch of reasons. And his thing was, look, I have a whole bunch of friends in China, and all the Chinese cities that have masked up have done better. And I was like, okay, when I get that information, I will change my mind. Well, hey, we've got that information now.
Here it
I
is.
changed my
Right,
mind.
here it is.
Yeah.
The Go ahead, sorry.
And one of the things I've really been happy about is how much the culture has changed, at least in my kind of progressive group, about face mask wearing. So many of my friends who are can sew and stuff like that have like literally made hundreds of masks for all their friends. They're making custom ones with cool art on them. I know Torrens Band has some, and here's a link to that on their Threadless store. Like Threadless now allows you to make custom masks. You can make an artist shop on Threadless, upload your image, and then sell face masks to people. And I've loved that cultural change where now people are actually enjoying and customizing and turning this safety face mask into this like little again individualistic thing. Like sure libertarian talking about your individual rights, wearing a mask is going to make you look like everybody else unless you put some art on it. You can put some art on it that you like. I've got my Mandalorian mask in the mail coming.
The other hashtag somehow that's been co-opted by libertarians is "My Body, My Choice," which is just kind of politically fascinating, right? Because that's a pro-choice hashtag, and so somebody says wear masks, and somebody will reply "My body, my choice." And then somebody will come in and say, another convert to pro-choice on abortion, and then the conversation, well, keep your legs together. It's not your choice.
Well, then don't come into the grocery store without a mask. Like,
yep, yeah.
I agree. I like sure in this you can't force people to wear a mask. But you can absolutely, as a private business, say if you're not wearing a mask, you can't come in here.
Yeah, I was in a store today that was like, please, we won't let you in unless you are wearing a mask.
Yeah, I get it. I think that's probably good for your employees. Like, and again, because of how we know how the masks work, it's much better for somebody potentially infected to be wearing the mask than for somebody who is not and doesn't want to wear the mask. Which means if you know your employees are all fine, then you need to protect them by getting all the people visiting the store to be wearing masks. So 100%, I understand.
The other thing I'm seeing, there's a bakery that we like to go to, Cobb's. Fantastic. And they've got plexiglass shields up by the cashier and the service desk, and I think we're going to start seeing a lot more plexiglass shielding. Or I hope so. So these physical barriers are things that are important.
I keep finding myself wanting to maneuver around them because I'm like a little bit hard of hearing because I've been in a rock band for so long. So I'm always just like, what? And then, oh shit, I'm not supposed to do that.
So you can get an app on your phone, Torin, that will basically play what its microphone hears but louder. So you can turn your phone into like a hearing aid, basically, and it's great for those instances. Just keep the thing in your ear, and then your phone will hear it. Yeah, you can move your phone close to them. Talk into this.
Practical advice. And as a fan of the band, why don't you guys wear earplugs when you're up on stage? Just get on that.
They do now.
They do now. Oh, okay. So this damage is
after the first 10 years we started doing that.
Okay.
Once the tinnitus set in, we were like, oh, wait a minute.
Well, at least you got to it in time. You didn't go full Pete Townsend.
No.
Who is nearly stone deaf because of his career in the Who.
That's a thing that I think aging bands should pass down to the new people, the new youths as they make their rock bands. Look, whatever you do, wear earplugs because you're gonna have those ears for the rest of your life.
Well, yeah, but has there ever been a 20-year-old in history who wants to strut around on stage and wear earplugs?
Gonna have to get artistic earplugs now so that you can look cool doing it.
See, we haven't invented those kids yet. So then, the mask thing kind of gets into weird and dangerous directions. It doesn't just kind of get mildly paranoid with take off the mask and Obamagate and your self-poisoning. But there's another video that I saw recently where a town hall meeting in Orange County was taken over. Drop that here in the link or in the chat. Taken over by activists who were just screaming about how wearing masks was just completely unacceptable. One really egregious individual said, "You might as well be putting a knee on our necks." Like, oh, okay, you're a horrible person on multiple levels. But that was the level of vitriol and intensity at this meeting, to the point that the the public health officer in Orange County, started getting death threats, and finally had to resign from her position over saying, "Okay, we've got to wear masks, folks." And the county itself backed off of its requirement and just made it a strongly recommended. So that's I'll grab that one for you too here.
Humans we're so easy to convince of ridiculous things.
Yeah. Yeah, and then the irony is, right, everybody who wants to get out and get back to it and have it, you could have all that. You could have all that. The Surgeon General of the United States put up a tweet about wearing masks, and we could I forget exactly what he said, but that freedom you want, you can have it if you just put on a mask.
That's
and
right, yeah.
Nope, we want it all, man. So the coronavirus just doesn't exist anymore.
So and I guess the answer to this is they don't, but I'm going to ask this question anyway. Don't the wealthy billionaires who run our country or run the country these days and have giant propaganda channels through which a lot of this bullshit comes, like they push it down, why don't they listen to this, hey, if you want the economy to go back to the way it was, everybody wear a mask, and then go, oh, we should even tell our people to wear masks? I don't understand why so many people on the right in power who have propaganda to change the world for the better for them. Like, literally, if you're this wealthy person who wants your businesses to do well again, you want the economy to go, you want people back to work, you want people back in stores, the answer is wear masks. And they're still fighting this, which either they have a more nefarious thought or they really true believer think that this is all fake.
Well, I mean, I think a lot of the right in the U.S. right now, and I'm just talking like an average dude here, seems to be captive to Trump, and Trump is not a mask guy.
Yeah.
I think he thinks masks.
Yeah, because he was saying that I was reading or hearing today that he wants to do he wants to get back into his rallies, and he's looking for a place where he wants to pack a place as full as possible, and he doesn't want anyone to wear a mask. So he's looking to try to find a venue where they will allow that.
So that's not what's happening on the 19th, or sorry, the 20th in Tulsa. I think he's got a rally plan there in a facility that holds 19,000.
Yeah, 19,000, and is tweeting about 200,000 tickets being sold.
Oh, the tweets are up to 800,000.
Oh, wow, fantastic.
Yeah, Rob Parscale is now claiming 800,000. Biggest rally in history, blah, blah, blah. So, and, here's the kicker. To attend that rally, you got to sign a release holding them harmless if you get coronavirus.
Oh, my God.
Yes.
So
this...
But I mean, if you want to go there anyway, and if you're a follower of Trump, then of course you'll sign that release because that's what you believe.
Because you're a true believer. It's a quote by Carl Sagan has been my Facebook cover photo for a long time, and it's because it's been 2 years now. I'm looking at it. It looks like I used to change it a lot, but it's so true. One of the saddest lessons of history is this. If we've been bamboozled long enough, we tend to reject any evidence of the bamboozle. We're no longer interested in finding out the truth. The bamboozle has captured us. It's simply too painful to acknowledge, even to ourselves, that we've been taken. Once you give a charlatan power over you, you almost never get it back. And we're seeing that countrywide now in America. Like, it's so bad, it's leaking. There are Trumpists in Canada who, like, legitimately wish that he ran Canada as well as America.
Yeah. Yeah. So I guess we're gonna see what happens.
Yeah.
There's some early data back now from some of the mass protests about rates of coronavirus. I think in some of the initial protests in Minneapolis, it seems like so far about 98.6% of people tested are testing negative. So the protests in and of themselves do not appear to be a major risk factor for the coronavirus, which is good.
Surprising and good news, yeah.
Yeah, but people who protest care about other people, so they follow public health recommendations. They wear masks, right?
Right.
We have yet to see the comparison,
especially if you're expecting tear gas.
Yeah, so we have yet to see what's happening in the places where people are getting kettled and gassed versus places where they're not. So that'll all be coming out in the days ahead. And I mean, if you're a betting man, don't bet against the tear gas. You should bet that the tear gas is an accelerant of coronavirus. But
unless we get lucky and tear gas like soap kills coronavirus, but yeah, probably not.
They should be using the soapy tear gas.
There's a non-zero chance that this chemical interacting with particles containing it would kill it. But I'm not saying don't worry.
If you soap in your eyes, you're going to be crying just as bad.
Yes, absolutely. That's what, if we could somehow inject the soap, Rob.
So directly into the body?
I'm just waiting for him to say it. They say soap works. Could we put soap into the body? Yeah.
No, he kind of did, right? With that whole cleansers thing, right? We've all seen the famous Sarah Cooper videos by now. Or I hope we have.
She's so good.
Yeah.
I've been following her for almost a year on Twitter because she's been funny, but she's basically become huge now because of those videos, which is great.
This has made her career. Yeah. Bleach, the ultimate soap. Thank you, New York.
Yeah. Oh, boy.
I just want to kind of looking over my notes here to see if we've. I wish I had a diagram of this. I couldn't find it. And a lot of people are asking, are we in the second wave, right? And so their idea is, well, the coronavirus did this, and now is it doing this? And really, it's kind of more like this, and because there never was that fall, and now
in most places, yeah.
Is this the second wave? No, you're still in your first wave.
Right. And we haven't hit the nadir.
Yeah, and I think a lot of the states that have started reopening, there's been significant acceleration of coronavirus cases. I'm not really sure. I haven't checked today's data, but as of yesterday, I think it was about 27,000 cases, whereas it had been stable at about 20,000 a day for a long time. So watch for that number to climb and climb and climb, unfortunately. But now it's thoroughly politically contaminated. So are we going to get people to go back into their houses? Well, without federal stimulus, I doubt it. So we're just going to watch bodies get fed into the wood chipper.
So a couple of things. Sorry, go ahead, Tarn.
I was just going to say, I posted on my timeline recently. Let me see if I can find the actual article, because there was something about how a lot of people who got the CERB are now already having to pay it back. There's
Yeah.
190,000 Canadians who receive CERB payments have had to repay them, CRA says, and that's from June 10th, I think. And yeah, that whole, because we in our household, I tried to get EI. My partner tried to get EI, and that didn't work, so she went to CERB, and then they came in at the same time, so then she had to give back her CERB, and just trying to navigate that entire
Right. So she's
situation.
counted as one
It's
of those
completely a
190,000.
nightmare.
She,
Yeah,
Yeah.
I mean, she was like, "Oh, I have to." She didn't get like a notice like you have to pay this back. She was
Right.
just like, "I'm going to do this now rather than
Sure.
have to deal with it later because I know it's going to happen."
Yeah, so she's part of that. This was a very quickly set up thing, and it had to involve interdepartmental communication. So I was going to talk about a couple of points that we've got that I think are going to work together, along with a third thing that I want to talk about. First thing I want to talk about was the 2-week lag between behavior and outcome is such a frustrating aspect of this. That, like, you can have an argument with somebody, say, about masks and go, well, you'll see in 2 weeks. And in 2 weeks, like, you will see, but that means you've still got 2 weeks of badness to catch up on before you finally get the out. Like, what you start to see in those after 2 weeks, that's the beginning of 2 weeks of badness from all of that. And then I want to combine that with like that lag thing that's going on with what you noted, which is people who protest care about other people, and they're wearing masks. And we're starting to get two different populations of humans right now. The mask wearers, right? And we've got the fiercely non-mask wearers. And we've got this very virulent disease that spreads, but it seems that wearing masks can help. Are we going to start seeing basically this tear through the Trump world, right? Like it seems like the place where it's going to catch on is going to be the places where people are less likely to wear masks. And I think,
well, America is still like 5 times as bad as or as bad as the next 5 countries combined in terms, and that is showing no
even in the good places, it's not that good. Right, but
so I feel like it's happening now.
Yeah. I just wonder if we're going to start to see. I guess the question is, now that we know about masks and people who care about people who are starting to wear masks, those populations, if you kind of separate them out, are going to see hopefully declines in COVID contamination, and then it's going to be even much bigger in the ones that refuse to wear masks and are no longer social distancing. And preventing this, and again, that's information that we will get after a 2-week lag, like maybe a month from now. I guess that's what I'm saying. I'm predicting about a month, 3 weeks, 2 weeks to a month from now, we're going to start hearing how COVID is tearing through the right wing, and surprisingly, not through the mask-wearing left-wing protesters.
I'm really worried there's going to be a ton of collateral damage.
Yeah,
it may hit right-leaning voters harder, but that might be very hard to tease apart in the data. I do know.
Just be glad Thanksgiving's not around the corner, because that's when all the left wings and right wings get together.
That's when they do, and to argue about football and turkey.
And argue loudly, projecting their particles.
Yeah, that's right. Yeah. This is going to be the uncle accelerant.
Hey, I'm an uncle.
The uncle wave.
So it's amazing, right? Everybody was watching in horror as New York was burying people in mass graves and using refrigerated trucks. And now a lot of cities have started to send out alerts that their hospital capacity is nearly full, their ICUs are running over 90% capacity. The exact same things we were hearing in late March, early April in New York. But no one gives a shit this time. No one's noticing, no one's caring. And there's this really weird death cultish defiance about the whole thing.
They're the this is fine dog, but instead of being in a house that's on fire, they're in a bunch of frozen. They're surrounded by frozen corpses.
Yeah,
This is
yeah,
fine.
yeah.
I should redraw that. Instead of flames, it's just like teeming piles of coronavirus, those little spheres with all the plungers.
Yeah.
Yeah, yeah. Or it's like the this is fine dog. It's on fire, and it's saying this is fine.
This is fine. Yeah.
Yeah, yeah. And drinking from a cup of
I
flames.
like you can choose. You have a choice between two new normals. In one, you wear a mask whenever you can't socially distance from somebody, and in the other, you're surrounded by frozen corpses. Which is the new normal you'd like? And we have these individualists demanding frozen corpse future. They literally are asking for the darkest timeline.
Yeah.
We're at one of those we're at one of those points. The coin is in the air. It's flipping there, and we get to choose how it lands as a society. We get together and go, what is the new normal based on this horrible thing that's happening? Is it the future of us giving a shit and wearing masks and socially distancing and washing our hands a lot? Or is it one where everybody just gets sick and dies and probably has permanent lung damage and who knows what else this does to you long term, because we still don't know, and are finding all sorts of terrible things that are happening to all of the survivors. Not all, but many of the survivors.
Lots and lots.
Like, yeah, it's brutal. And they're like, oh, that's the one we want. We just want to suffer through it and not be smart humans who analyze and learn and affect the future. We're just going to be animals who get wiped out.
We're gonna roll with Dear Leader. It's fascinating that there's this phrase that epidemiology Twitter is using called BRIMUS, BRIMUS, and it stands for Brazil, Russia, India, UK, US, Mexico, and it's the countries that have had the absolute worst outcomes. Because interestingly enough, Brazil is already way past 1/3 the deaths of the United States. Brazil has ticked over 48,000 deaths, I think, as of yesterday, and which is really saying something in a country that's not nearly as populous as the United States. But
2/3 of the population.
Oh, 2/3. Okay, so
209.5 million. Yeah.
Okay, well they're going to be punching above their weight before too long. And if you look at the top three, right, Brazil, U.S., UK, what do they have in common? Really right-wing, authoritarian, white male leaders who just have no interest in hearing from their public health authorities.
Yeah, I saw a meme of photos of all the female leaders, like probably like 8 of them, and their countries, and how all their countries are doing very well.
Mm-hmm.
Yeah,
and
yeah,
maybe there's some kind of correlation there.
Right. Yeah. So leadership style is playing it. Is this is where the rubber really meets the road on? Are you actually listening to your scientific advisors and implementing their recommendations? You know, BC, we've got Dr. Bonnie Henry, who I think has managed to stave off what could easily have been a total disaster. Right. BC was possibly on the edge of a massive breakout. Things were. They could have broken either way, but we jumped on like really early with very stringent public health measures, and I think that putting that breakwater up really early made a huge difference for us. It's not something you'll ever see because when public health works, nothing happens.
Right.
I'm not going to say nothing happened in BC, right? We did have a number of deaths, we did have a lot of cases, but it wasn't nearly what it was. And she managed to accomplish that even though dentist went ahead and had a conference that she and the BC CDC didn't want to have happen, even though it took a long time to get the federal government on side to actually put in decent measures at the airports. Right? People were saying, "Why isn't the province doing anything about the airport?" Well, unfortunately, international airports are federal jurisdiction. The province can't just march in there and say, "We're putting in public health measures. We're going to take your temperature and do contact tracing, and we need information." So that was a real leak here in BC for a while. But even despite that, we managed, and lots and lots and lots of international flights, of course, from China, from Iran, which were two of the early countries that broke out with a lot of cases early. And there's a really large Persian community in Vancouver. There's a really large Chinese community in Vancouver. So, so that we had that going for us. Also in Richmond, which is a Chinese majority community, they were on social distancing, mask wearing, hygiene in January, which is fascinating. They were getting sources of information from Hong Kong, from China, from
their
Taiwan,
relatives.
from their relatives, from their networks of information. Many of whom lived through SARS, who lived through the Hong Kong flu epidemic in '98, who've lived through bad outbreaks. And I remember back in January seeing pictures of just completely empty Chinese malls in Richmond, going like, wow, what is going on? Why is that happening? And I remember there was this early explanation, well, this is just racism. Well, but then it's like, well, no, these are Chinese folks staying away from Chinese malls in Richmond. And I know that a lot of our provincial health officer has resisted putting community-based data out, like where are the cases, what are we tracking? Well, one day it accidentally did come out, and Richmond had almost no cases and hadn't had a new case in days. So I think part of what helped BC's success is what was going on down in Richmond as well, which is really interesting. It's kind of just one of the untold stories of how we've managed to be so fortunate, despite a lot of reasons why we very easily couldn't have or shouldn't have been as lucky as we were. But that kind of swings back to our politicians are listening to science, and the places where there's female leadership, they're just being more collaborative and more cooperative and more evidence-based.
Evidence-based. They're not I know what's right type of leaders.
Yeah.
Which is 100% what Trump is. He makes something up and says, I'm right. And then you
Trump,
just have to
Bolsonaro.
work it through.
Yeah.
So going back to masks, I just saw that I clicked through to my browser and accidentally clicked my Facebook, and this was at the top. Marilee actually posted this, so maybe you know about it already. The title of the article is 2 infected Missouri hairstylists were wearing masks. None of their 140 customers, also masked, got COVID-19. So infected, both them and their clients wore masks. Nobody got infected. And that is some pretty good evidence there that masks are effective. I'll put the article in here.
And in every dystopian, libertarian, future hellscape sci-fi movie, it's always in the desert, and everyone's wearing masks to keep out the dust.
Yeah.
You get to have your dystopian hellscape. You get to have it right now. And there's still water and gasoline. So you get to play dystopian hellscape on easy mode, and you won't even put a mask on.
The coolest.
There's not enough Bane masks on the marketplace.
One of the coolest sci-fi characters ever was introduced at pretty much the same time that this virus showed up, and he lives in a tribe that proudly doesn't reveal their face outside their mask to anybody else.
Oh, that's right.
The Mandalorian. Right? This is the way. And that's... I've ordered a mask off Threadless that has the Mando helmet kind of printed on the bottom of it. And I 100% am looking forward to saying this is the way to other masked people.
That is the way.
This is the way. I am a nerd, Torin. That's why we're friends, you super nerd.
Oh, yeah, that's right. I forgot about that. I would like to, if I may, speaking of China and speaking of masks and speaking of being a nerd, me being a movie nerd and loving to go to movie theaters, I've been kind of keeping abreast of the situation with cinemas, and I came across this article from Variety.com that said Chinese authorities announced that cinemas in Beijing must remain shut after 3 new coronavirus cases were discovered in the capital. Beijing found its first COVID-19 case in nearly 2 months on Thursday. Xicheng district resident who had not left the city in the past 2 weeks. 2 additional new cases in a different district were announced on Friday. Officials said that cinemas, KTVs, which are karaoke bars, and other indoor entertainment venues should temporarily remain shut. They've been shut since late January. The country's top administrative body, the State Council, said on May 8th that entertainment venues, including cinemas, could resume work, but no local directives to do so ever emerged, leaving cinemas vacant and in limbo. And the turnabout in the official stance on reopening created an unpredictable environment, making planning impossible. More than 2,300 Chinese cinemas went bust in the first 2 months of shutdown alone. Meanwhile, cinemas in Canada and the US have already begun reopening despite their respective countries' ongoing struggle with the coronavirus. So it's going to be interesting because I do want to get back into the movie theaters and seeing, all the great movies that are coming out, Tenet and Wonder Woman 84 and all that kind of stuff. And I'm kind of like, well, I want to go, but I want to be safe as well. So I guess we'll see. We'll find out.
Soon.
Yeah, I can't.
I'm not going anywhere where I'm indoor and sitting near people and in recirculated air and stuck. Right? It's got the close contact, it's got the crowding, and it's got the enclosed space. It's got all 3 C's.
Yeah, exactly. Although let's do a live check-in with the Twilight Drive-In in Langley. Let's see what they're playing. Grease, Harry Potter, Django Unchained. That's coming up. I've seen all those. I want to see some new movies.
I'll stream
world problem.
I'll stream new movies at uTorrent. I'm sure I have a bunch you haven't seen. Have you seen Prospect yet? Did you see Prospect?
No, I don't think so.
It's a really good low-budget sci-fi movie. I think you would enjoy it quite a bit.
That's from 2018.
Yeah.
It's on Netflix.
Prime or low budget?
Oh, is
low
it?
Is low.
Is it?
That's what it says on Google, but it could be U.S. Netflix.
It might be. Yeah, it might be on Netflix. I don't know. I don't have Netflix right now. Have we got a Penguin story? Are we wrapping this up?
I do have a Penguin story, unless there's anything else Rob wanted to touch on. Actually, are we going to talk about next week? Are we talking about vaccines and stuff like that again?
Well, we're going to have Dr. Greg Rose, our infectious disease and infection control specialist, back on, and he'll be able to really refine what's going on with masks, the development in mask science, because infection control and prevention is what he does for a living. So he'll be able to kind of give us the update, the lay of the land on what is the state of the art in terms of safety.
So the title for that show will be "This Is the Way."
This is the way. Yeah, that's right.
Well, I remember reading this week something about some vaccine trials going on from China in Brazil.
Yeah, it's almost time to have Dr. Van Houten back on, because that is a fast-moving field as well. There's one vaccine that's already moved into phase 3 trials. There are about 10 vaccines now in phase 1-2 trials. So we need an update. It's amazing how fast vaccination is moving, and really that's what we need. That's going to be the only way we're going to stop this thing.
So penguins.
But in the meantime, we have masks. Wear masks, please. My God, I'm begging you. I'm looking right into the camera
Rob,
and begging you.
Have you not been paying attention to the world? We're going to get a vaccine, and then the fight's going to be no way that you're installing an Obamagate tracker on me.
I'll take the Obamagate tracker.
We're
please.
Still effed. Yeah, I guess that's the thing. If the vaccine works well enough, it doesn't matter that those assholes will refuse, I suppose.
Well, let's hope that we're lucky ones who get a good, robust immune response from the vaccine.
Yeah. Hooray!
There's enough uptake. I have a feeling that the vaccine is going to be wildly popular, because this disease is bad.
So is cult-like behavior. I don't know. Every time I think we've hit a bottom, there's a new bottom. And also, it's going to be non-zero. We absolutely know it's going to be a non-zero number of people refusing.
Oh yeah.
So it's the question is, how big will this is a conspiracy to implant a tracker in me, I refuse your vaccine, will be.
Right. Yeah. So anyone who ever wondered, how did Jim Jones manage to get all those people to drink that poison? Look around, man.
Yeah.
It actually wasn't that hard.
'Cause humans. So
step
don't
by step.
be one.
led them to the cliff step by step. You come down a staircase in 2015 and you say, when, Mexico, they're not sending their best. And boom, here we are. 5 years later, June 2020, and there's going to be 19,000 people with no face masks in a crowded, packed rally in Tulsa, one day after after Juneteenth, in the home of the Tulsa massacre.
Yeah.
Except it's going to be the biggest own goal in political history.
Yeah, it's going to be bad. It was going to be on the 19th, right? And then there was the uproar and they moved it. Is that right?
Somehow this was the uproar that Trump responded to. He hasn't responded to any other uproar, but this one somehow got through.
I've seen somebody who who deciphered that. It was probably their plan to do the 20th all along. They did the 19th to get they announced the 19th to get the uproar, and then they get to go, look how much we care about what you complained about, even though they do it on the day they wanted to do it all the time. And then they get to have their white supremacist bullshit and argue that they're not, because they listened to the black community about moving it.
It wasn't as plausible as it is.
Yeah.
That's just entirely too plausible.
It makes way more sense than Trump giving a shit. I can totally see Stephen Miller having that plan. Just tell them it's the 19th. They'll get upset, then you'll move it.
Yeah, that is one Machiavellian bastard.
Yeah. I don't buy that Trump's all that smart. Stephen Miller's not even that smart, but he occasionally gets those kind of trolley moves down. You can see it happening.
He probably read The Prince in college and thought it was an instruction manual, not satire. So we've got a couple of animal stories here for you, Mr. Atkinson.
Do you want to do your duck one?
Well, if you feel you're familiar enough with it to pull it off, you can go ahead and do the duck story.
Oh, well, I want to do the penguin one.
You want to do the penguin one? Okay.
Yeah.
Well, since we closed on penguins, let's close. All right, we got a duck fan. All right, so I'm gonna let's get this link here. Yeah. So it may surprise you to learn that in New Zealand there is a duck. Well, it won't be surprised that there's a duck named Star, and Star only goes out wearing a bow tie, and Star likes going down to the pub. When at the pub, Star enjoys quaffing a pint of ale.
As we all do.
Unfortunately, things didn't go so well, and Star was at his usual pub and drinking his pint and got into a fight with a dog.
His watering hole.
So, yeah, the headline, duck walks into pub, downs pint, fights dog. And here's the article. The duck actually got pretty seriously injured in the fight with the dog. It's split. Its bill partly split.
Oh, no.
But they got it to the vet in time, and Star is expected to make a full recovery.
Good.
It's going to be a little bit awkward at home because both the duck and the dog live in the same house.
Oh, my God. So they went to the bar to get in a fight?
They went to the bar to get in a fight, yeah.
So they get outside.
The dog knew the duck was an alcoholic and was not supposed to be drinking. It's like, hey, stop that. And the duck was like, you can't tell me what I can and can't do. And then they fought.
You promised me. There's a great video in the article of the duck drinking beer. That might be the best part of the whole story. The duck drinking beer while wearing a bow tie. It is sensational. So, yeah.
What a world. So this article, there's a couple things. When I first read it, I was so confused. So I'm going to start with just some background information that wasn't 100% clear when I read the article. So Chester Zoo is a zoo at Upton by Chester in Cheshire, England. Chester Zoo was opened in 1931. It is one of the UK's largest zoos. Iceland Foods Limited is a British supermarket chain headquartered in Deeside, Wales. None of this story happens in Iceland. It has emphasis on the sale of frozen foods, including prepared meals and vegetables. So the story is Iceland supermarket adopts every penguin at Chester Zoo after appeal for help. Many zoos are enduring the biggest crisis they've ever faced after being forced to close their doors because of the coronavirus. One of these is Chester Zoo, home to 35,000 animals, which has said 97% of its income is generated through visitors to fund the 1.6 million pounds it requires every month to keep going. An appeal was put out by the zoo recently for donations to help it survive during the pandemic, and more than 2 million pounds was donated. And now it's had another helping hand thanks to Iceland Supermarket, which reached out with an incredibly generous gesture for some of its cold temperature buddies. Iceland has signed up to adopt every penguin at the zoo. They said, we've joined the fight to save Chester Zoo and have adopted the penguins. The zoo has over 35,000 threatened and critically endangered animals, etc., etc. So what I'm not 100% clear on where are they putting are they going to be behind the counters in the supermarket serving the patrons?
They're just giving them money to feed them, Torin. They're not actually adopting them to bring them into the... But it would be perfect to have them hang out in the freezers.
And then this follow-up came today, which I will put in the chat as well. Same story, so follow-up from Friday. After announcing that it's adopted all the Humboldt penguins that live at the Chester Zoo, Iceland, again, not the country, has announced that it's donating all profits from sale of McVitie's penguin bars to the cause too. So I've never had a McVitie's penguin bar. I wonder if it's like, is it an ice cream bar? I feel like it must be.
It's not penguin meat.
It looks they're chocolate. No, they're cookies. They're called biscuits in biscuit crackers.
Well, there's biscuits and bars. I want to see an image
Penguin
of this.
biscuit, milk chocolate covered biscuit bars filled with chocolate cream.
Yeah. Okay.
Endorsed by Ischemia. McVitie's makes amazing digestives and cookies.
Perfect. Okay. That means that shoppers can pick up a penguin while also helping to support Britain's largest and best loved zoos during these difficult times. So
I guess this store is not called Iceland, it's called Iceland.
Interesting.
Right? The land of ice. It's Iceland.
It's spelled like Iceland, but okay. Well, yeah, I don't know. I've never been. This is the first I've ever heard about it, which is why it was so confusing to me.
Yeah. I thank you for being... I feel like the L should be capitalized. I thank you for being clear that it's not about... This article I'm looking at says they helped them out in the most Icelandic way possible. They're Icelandic. They're the land
I think
of
they
ice.
should at least be in the frozen food section, just kind of like wandering around freely while people are doing shopping. That's what I would like to see.
Yeah.
Is it humane? Is it ethical? I don't know. Just put a little soda jerk hat on them. And bow ties, of course, to go with their suits.
Well, then we'd have to adopt them.
Oh, I don't have the facilities.
No, I don't know. Yeah, the facilities. Is that what we're calling money these days?
Yes. And I don't have a litter box for penguins.
Do they poop in the water? These are questions that we should have answered at some point. I don't know where. Is there? This is a question that a penguin scientist would know. Do they poop on the glaciers, or do they go in the water and poop and then leave their glaciers clean?
After we get a vaccine and all this hullabaloo about the virus has gone away, we can get our penguin expert on.
I long for those
penguin episode.
I long for those normal days of looking up dumbass information that doesn't matter. That's fun. This stuff is all harrowing and fills me with dread for the future.
Penguin transmissions. I'm already seeing the spin-off series.
That's right. Hey, viral transmissions does not have to mean it's about viruses. We can just be talking about things that people are talking about.
Memes.
Because they've got memes. They've gone viral.
Oh God, another stream about memes?
Yeah, but it's old guys. Old guys react to memes. I don't get it.
Old guys try to understand memes.
We need to do react videos. That's the way to get viewers these days, is react videos. Okay, I think
Viewers, I don't need them.
I feel like we're done. Can everybody hear that?
Yeah, I hear that.
You're a cat. I think.
Sometimes.
That's my roommate playing League of Legends. Somebody just
Wow.
attacked her, so she screams.
Oh. Okay. So
So that's
like
her
a cat.
reacting to a video game of somebody in a
right.
video game attacking
So
her.
the chat is bidding us farewell.
Thanks,
Goodbye,
chat.
folks.
We'll
Never
see you
a good
next
sign.
week.
Please leave.
7:00, right when the healthcare cheer should be starting, and who knows? Maybe when the numbers go rising in some places, that healthcare cheer will come back, or maybe in those places it's stayed up. That's a possibility. We'd like to hear actually if it's still happening in your area and how prevalent COVID is there. That might be a thing to figure out. I like that.
News. That's what we want.
news,
We're
yeah.
hungry for the news.
Speaking of news, spread the news about viral transmissions, not the virus. Wear a mask. Take care of yourself. Viral transmissions. What's T? There's T. VT? VT. Thanks so much for watching. We'll see you all next week. This has been great. Let's get to that title card. There we go.